They have like
Actually, all I want is to go home.
You don't sit on the outside, like where you like the
I'm really like
sky curtain.
not looking forward to tomorrow.
That's not
Are we
hard.
streaming? Yes, we are.
It's just the sky train.
But also, that maybe
The long
other
thing.
room.
Oh yeah.
Or you know the
Maybe
one
that
that
means that we takes our posters like first thing.
Yeah,
And I
yeah.
will show you again.
Yeah.
But the last.
I went to.
Hey,
Would you go over the summer?
it's enough for me.
I'm so down.
We should go.
I did
I was
last night.
there
Like
last
my
time to try. Oh, there's
It's in
there's a
Chinatown.
climbing
I think
gym.
that's really quite nice. Quite
Besides,
fun.
when I was walking there,
Why?
I was right
Oh,
outside
I don't think she made it
some
to
like gay crackheads. It was pretty sad. Right next to like across the street from Science, it was like the most sketchy street you could possibly imagine. Like every square inch is just filled to the brim.
We should go to East Station. My friends live.
Jimi Hendrix used to be.
Yeah. We should go for a sound check.
Why not orange? Can you save it? You can save it.
I was like, don't mess it.
No, it wasn't fake infographic. It was like a spot in Vancouver. I forgot where it was.
For real,
A lot of
it's pretty
spots.
Oh,
It's pretty large.
I think it's pretty fake.
weak.
Do you know what there is in Richardson? Very Richmond. That place is a dead center. It's pretty bad. The only fun thing in Richmond is the go-karts.
No.
Oh,
And even then,
there's actually there's a
Bro, below the mall in Burnaby.
I know. I
We
don't
got that. We got
They
this.
have hot pot there.
Yeah.
I swallow like something without chewing. I burn my insides.
Thanks, man.
We'll bring it.
Okay, we're going to do the background of proxy decision making and the ethical foundation of it. Gentlemen, you will need to separate your desks before you leave the class because we'll need to put it back into test methods. So last day we picked up who would be people's proxies, who would you choose. This roughly corresponds with what the law says. We're missing the spouse, but none of you are married, so that makes sense. I'm assuming none of you are married, or at least yet. Maybe some of you have decided on a May marriage this next weekend. So why do we have them at all? And that comes under the principle of autonomy and respect for persons. If you are incompetent, what is it that you cannot do?
Make decisions.
You make decisions. And if you're not allowed to make decisions, you don't have any autonomy. So if you don't have any autonomy, you don't have any ability to make decisions, then you're not able to exercise your rights. You're not able to make any decisions as anyone else would make a decision. There's probably decisions you need to make about the quality of your own life. The classic example that's going to be down here in a moment is if we gave matches and gasoline to a baby, they'd probably want to do something with it, but if we allowed them to make that decision, they wouldn't be able to see how much that would be harming themselves. Everyone has the right to self-determination. But if you're incompetent, you can't exercise that right. And we allow an incompetent person to decide. We honor their decisions, but we don't make allowances for his or her lack of competence. Now, baby with matches is easy. But there's one that comes up every year with the prefix. Missing it on this.
say we don't make allowances for his or her lack of competence?
Baby, matches, gasoline. We've made no allowances. We just say, here, have fun.
What do you mean no allowance?
They're incompetent. What allowances should we make if we give a toddler matches and gasoline?
What's an allowance? Like, what do you mean by an allowance?
What they're allowed to do.
Oh.
Not. I hadn't thought of it in that kind of. Allowances means the scope of which you're allowed to interact with something. So what allowances do we make? So what special things do we set up? So if you are allowances in golf would be the handicap system. So if you're less skilled, you're allowed a handicap. Allowances would be restrictions on various things for safety. So you must be taller than the sign to ride the mechanism at a park. We allow for the fact that students are going to make mistakes. And so we've built in mechanisms in order to allow students to make those mistakes without getting, say, expelled from school. How do you make a mistake at Brentwood and then don't get expelled from school? Probably fairly useful at this time. Last year at this time, or the last 2 months, we had 47 people either suspended or expelled from Brentwood College School. This year, our odds are doing a little bit better. Not good, but better. Better. Makes sense.
Was there like a big event that got 47 people suspended?
It was one open house, I think.
There was an open house, and there was the Allard open house this year.
Back.
But there was a couple of things, yeah. Last,
Max was in last year? Think of it.
So, but this
Yeah, I think it was
is
Anyway, we don't need to know who exactly it was last year. Zane? Yes.
So isn't it just saying like we allow incompetent people to decide, but we don't we don't like make allowances for their lack of
Right. So if this is a suppose, we allowed an incompetent person to decide, and we honor their decision as they have made it in their incompetent state. So how would you like to set it up if you were going to say have someone play with something like matches and gasoline,
Yeah.
and they were a toddler?
Yeah.
What changes would you make, Lisa? What are you doing? You keep tilting it. You're either taking selfies or taking pictures up here. I'm not entirely sure.
It's not
If you could put it away, yes. Obviously, what's going to happen to the baby if we do that?
It's gonna die.
It's going to die. All done. Thank you. Catch on fire. I like how that implies it might not die. Horribly gruesome, terrible, terrible death for the poor baby. But let's say there are many things that babies pretend to do that are dangerous. Just the other day I saw, it was like a Fisher-Price chainsaw that you can buy. So the baby can be like, whoa, and pretend to actually be cutting through it. Friend of mine saw a little baby woodworking table where you can like screw things in, and they're big plastic things. You've got a fake drill. Well, fake, it really works. You can screw the big plastic bolts. Unfortunately, they didn't get that. The person who was going to buy it was like, these aren't real tools, and actually bought a 6-year-old like a set that had like a real hammer and a real everything, which the parents have now taken away because the first thing the baby did, toddler, with the real hammer. Yeah, he didn't actually hit himself in the head. Not on the arm, no. Very, very smart. Right. He hit right in the middle of the glass table in their living room. Now, it didn't shatter it, but it did crack it quite badly. And so they have taken away all the tools. But, you know, baby did learn something. Learned that was a very exciting noise, and they really liked their new toys. So we make allowances. We make things out of plastic. We give them things that they can kind of do. Because we're accounting for the fact that they're going to make a decision incompetently and not realize the consequences of their actions. However, we are also exercising our decisions in their best interest. You want a hammer? Here's a fake hammer. Now go squeak, and you can run around hitting your brothers and sisters and others, or at the table, and you're not actually going to harm anything or yourself. So if we don't make allowances, who gets punished?
The person who harms himself.
The person who harms himself. So the toddler certainly should get punished, and of course everybody else around them. There's a limit to your principle of autonomy and respect of persons. You can't infringe on others. So if now the toddler gets to go around and smash everybody else's stuff, everybody else is going to be upset. So, in a way, we're kind of punishing the incompetent for their lack of competence. It's the equivalent of taking someone who only has one leg and saying, yeah, you have a perfect right to go up and down the building, and then push them down the stairs. They can't walk the stairs. That's why we have elevators. We find other ways for them to exercise those particular rights. Similar with incompetent people, we need a proxy. Now, the proxy shouldn't be making a decision based on whose interest. Their own. That we shouldn't be taking little toddlers and saying, you know what, you would fit into a chimney. And like dipping them in the chimney, and they give them little brushes, and they can brush the chimney or dress them up in I've actually thought this would be a great idea. Put them in a onesie, and then make sure there's lots of little cloth ribbons. And then you just spread water and soap on the floor, and as they crawl around, they just clean your floor. They probably also find it fun. I'm not actually seeing too many
What if they
downsides.
drink it? What if they die? 'Cause they
Yeah, but on the other hand,
Side effect.
It's just a vape.
It might cure COVID.
it is easy to make more babies. It's possible to do it by accident.
I know, but why go through the hassle if you could just keep this one?
That's true.
Adopt
That's true.
one.
So the classic example, as I said, child wishes to play with matches, cannot understand the danger of being burnt. Or you allow them to play with the matches, but you're there to make sure they do so in a safe way, as I kind of did to my younger brother. He didn't burn himself that badly. If we allow them to do what they just want to do, it's an incompetent a need. Is it an incompetent need? It's a need from an incompetent place. We're not really respecting their autonomy because we're allowing them to hurt themselves and others because it exists in that center of incompetence. But at the same time, we can't just make decisions that benefit us. It has to be things that they, would want if they were competent. This does put us in a very odd position of we're not allowing them to do what they want to do, but we're doing the things we think they would want to do if they were able to think if they wanted to do them. Yeah, it hurts a little bit. And the courts also find this. You'll be really excited to know that with today's notes, we have two kind of really nice and dry court cases. They're not that dry. One relates to the fact that the Nazis came to Canada to learn all about our sterilization procedures. Pre-World War II. It's a very exciting time in Canadian politics. So, finishing off the definition, a proxy decision maker allows the incompetent to make a decision and act. They're not using their own criteria, they're exercising a duty. Your parents should not be withdrawing money. If you could put away the phone and music, put it in your bag. Bag away. Your parents should not be signing you up for work and then taking all of your money. Self-interest in this is not the purpose of a proxy. The proxy is to allow a person to make a decision. In much the same way that an artificial leg allows someone to walk. So you are providing essentially an artificial brain. This is different a little from like an old standard in which it was kind of viewed that, parents kind of own their children. You could sell them or force them to work for you. My grandfather was adopted. He was not adopted by a family that, wanted to adopt children. He was adopted at 7 years old because they needed another field hand, and so he was allowed to sleep in the barn. This is in Russia, just before the Russian Revolution. So he had a fairly hard upbringing because it was definitely you are here to provide us with a monetary advantage. And you do find cases of, what's that picture? I never thought to include it, but I just thought of it now. While you're writing, you can grab it. There have been times, relatively recent times, when people have tried to sell their children. You know, they are annoying. You do have to send them to Brentwood, so that's really expensive. This is obviously not sending to Brentwood. This is, we are in the middle of the Depression, and we can't afford to feed our children. So maybe we can find someone else who would be willing to feed them. They'd probably be bought for manual labor at the best outcome. But that is not the purpose of the proxy. Proxy doesn't own the person. You can't make financial interest on that. One of the reasons the Free Britney campaign existed is because it seemed to be apparent to everybody that her own father was taking financial advantage of her singing career and the money she would make, and she wasn't getting the benefit out of it that she deserved. Britney Spears. How many of you have not heard of Britney Spears? One person. I will type in best Britney Spears song. And see what comes up. No, I don't want every song ranked. Britney Spears, greatest hits. And nope, can't do that one. That's not appropriate.
Oh.
And maybe that one is. Is that one appropriate? She also changed the rules at Brentwood College. Yeah, that was amazing. Let's. I'm gonna get totally counter. I guess would be the best way to put it, in which her ability to handle fame, money, and run her life was considered to be in doubt. And given how much money she was making, the courts decided that she needed a proxy decision maker. She was no longer allowed to make her own financial decisions. Kind of like the opposite of Taylor Swift, who is famous for making all of her own decisions now. Only recently was she freed for this. Normally this is for like a semi-permanent case, like you get really old and then your children take over all the proxy decision making for you. But it's not meant to be a temporary thing often in law, so that lasted a long time because we're not used to having to undo them. So we're allowing them to make a decision. Now, a very common one I hear from prefects is, you need to walk around, you need to make sure everybody's doing their homework. That's part of the job as a prefect, you're making sure that they're sitting down. However, some grade 9s are more irritating than others. So what would be a defense by the prefect? I'm like, I don't really, what's going to happen if I don't watch their homework? Why do we need to do this? Because they, fill in the blank. They're annoying, yeah, that's why they want to stop. What's the reason that they would give, what the reason you would give was like, I don't actually need to watch them.
So they don't actually have time?
Oh, they do, they always have. They say they don't, but they always do.
Like, it's not your responsibility to, like, make sure that they're doing work. Like, their grades are like their grades.
Their grades are their grades. They will be punished in the classroom. They won't do as well. However, if we add, or if we tell and set it up so that grade 9s are making their own decisions about homework, how many of them are going to do their homework?
No.
None. We need these kind-hearted grade 12s giving back for all the grade 12s that helped them do work in grade 9, 10, and 11, kept the house reasonably quiet, and kept things moving along, because it's too young to have the ability to sit quietly during prep without being distracted for an entire 2 hours. One would hope the grade 12s can do it, and one really hopes that you've learned how to do it by the time you hit university, but the grade 9s need some training. If we allowed them to just like do what they wanted, chaos. It would be chaos, I tell you. It'd be the equivalent of being burned by gasoline. So, the criteria we currently use, and then we're going to look at some cases. Obviously, previous wishes. You may have said something that allows us to know. Zoe, yes.
It's the washroom.
Yeah. There is a limit to previous wishes. If you're 35 and the last time someone asked you about whatever it is that they're going to do, you were 19 in university, you probably have vastly different views and needs and responsibilities now. So it doesn't always work. You could look at the, lifestyle that's going to come up. What does the average person with a high-powered career, 7 kids, and 12 dwarfs want in life? And you look at other people in the same condition, you go, oh, it's probably more like this, and we won't take the wishes of when they're 19. But they can stick around. And your previous wishes can count, even if it seems incredibly unfair and awful. So be careful about what contracts you sign. The most recent one I heard about was they were discussing different ethical court cases. Someone asked the question, what is the most unethical but enforceable legal thing have you seen? And the lawyer was like, it was a prenup. A prenup is when you sign an agreement before you get married. If you ever get divorced, here you're going to divide your assets. And they had signed a prenup that if they got divorced, the female partner would get $70,000 a month in alimony. However, For every, during the course of the marriage, I think it was like 5 pounds she gained, she lost $10,000 a month. They eventually got divorced. That went to court, and the lawyer for her case was like, obviously, this is arguing about weight change. You have autonomy of your body. This is not fair, and they had a variety of arguments. And the judge openly said, "This is the worst thing I've ever seen. This is not a relationship that most people would want. However, that person had the right to sign or not sign the contract, and she decided to sign it under those conditions. She obviously was interested in something, probably the $70,000 a month, which is not a bad incentive. To be honest, she should have just divorced him a week later and gotten $70,000 a month. That would have been, I think, the most monetary advantage. And it was held to be enforceable, even though everybody agreed it's a terrible, terrible contract. So your previous wishes, especially if in a contract, will definitely apply. Position deducible from lifestyle. Again, person in university versus, 10 years later as a father of 18 children. Might make very, very different decisions. And that's often, if you are the proxy decision maker, maybe that's all you have to go on. Talk to other 35-year-olds, 78-year-olds, 93-year-olds. What kinds of things do they want? Do they find useful? Toddlers tend to like the same kind of things. Stick them in a box and tape on their toes and they'll be happy for at least a few hours. If you don't know what to do with a toddler, stick tape on them. Even a baby that can just barely walk, watch them so they don't swallow the tape. But then they take off the tape and it takes a long time to get it off. It's stuck to their hand. And then they try and get it off and then it's stuck to their, they'll do that for an hour. They're not very bright. Toddlers are pretty dumb. You have nothing that you know about them, so we don't have any previous wishes. We don't know anything about their lifestyle. Maybe they've always been incompetent, so we don't know what they would like. Then we just do the objective reasonable person. What would the average person in the average circumstances that's making rational decisions want? Or you could use your own. I will sign my children up to dive down chimneys and sweep them and start my own little company. Doesn't even have to be that. There is the issue of something we call parentification. Have any of you have heard of parentification? How many of you have more than 2 siblings? A few of you. Parentification is when the eldest or the eldest couple ends up doing the vast majority of child rearing, changing the diapers, watching the children, free babysitting, and their own needs become secondary to taking care of the children of their own parents. And essentially the older siblings become the parents in this particular case. That, depending on the amount, could be viewed as exploitation by the parents. We're making the decision. If we tell you you have to babysit your brothers and sisters, then you probably kind of have to do that. But if that's at the expense of your own education, your own choices, then that might be too much. That might fall into parentification. So in that, they're making the decision for you of what you have to do, but they're not considering your own particular needs. Worst case scenarios of that would be, you can't go to university because you need to stay home and help us take care of the new baby. So ideally, your parents are exercising decisions on your behalf in your best interest, which is not always going to be what you want, but as it was quoted in House, should sometimes be what you need. healthcare professionals have been shown through research not to make as good as decisions as the above. Even someone objective using the objective reasonable person doesn't make very good, makes better decisions than the healthcare professional. Healthcare professionals are kind of biased in saving your life, regardless of any other consequences that that may have to the quality of your life, because that is literally their job. So they may not have an objective point of view. They have all the knowledge, they can tell you what's going to happen, but they should be external to that. Of course, if there's no other proxy around, they're going to end up doing this quite a lot. So when we can, this is why they're asking for the next of kin or the next person who can be a proxy. We're going to talk about a court case, the Stephen Dawson case, and the subjective substituted judgment model. This is the US model. It's not considered ethical in Canada. That is not a burn against the US. The Canadian model is not considered an ethical model in Canada. So we'll discuss that one. Now, depending on how far we get next week, we are probably going to, I'm hoping to do a practice final on the essay portion in which I will show you a scene and you are going to interpret it with all the ethical knowledge you have so far, including proxy decision making, all the way back to the beginning, things like informed consent, doctor-patient research, that sort of thing, and competency. Now, the subjective reasonable standard says that you must substitute yourself into the incompetent person's position and decide what they would want while mentally substituting yourself into that position. And you must always be in favor of it. I should quickly do attendance. Timmy, Ben. Is Ben here? Oh, there. Lily and Archie is not here. Kirsten. Lila, Zoe, Lisa, Felix, Zane, Casey. Annabelle. Thank you for not going to Playland.
Yeah, I didn't know.
Well done. Excellent. Perfect. Ava, Clara, not here. William K, there we go. William Lee, Kate Martin's not here. Violet's not here, and Brandon's not here. But Hugo and Parker and Had and Anish and Kieran's not here. Kate Blunt's not here. Anderson is.
Is that a tower? Yes. Let me just calculate this.
Yeah, that's what I was talking about.
Okay, if I've done that correctly. Good. There's at least two problems with that substitute decision making that I've just put in there. Getting those little groups, you've got like 2 minutes. Discuss. What is at least one problem? I think there's at least two. What's at least one? Go, 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 go. Anybody notice that they're in a group that has someone who's not here? Who? Who's not here? Oh, Lisa's here. She must have gone to the washroom. And Felix was also just here. Are they the two people in your group? I will tell them when they return. When you use the restroom, please leave your phone behind, either on that big black desk there or on your desk. When many people start leaving, they all have their phones in hands and start getting a little suspicious. Okay. There's at least two, maybe three actually, problems with this. Discuss them in your small groups. Just join another group until they arrive. What is the problem with this particular standard? There's at least two problems.
What's
What?
Ah, Lisa, you're with Enhad,
I also feel like
as is Felix, who is also not here.
an incompetent person might have like a completely different way of life than you, so like it's kind of impossible for a competent person to substitute yourself into the position of
Yeah? So, yeah. What are the problems with this model given this description of it?
It's kind of difficult.
Felix, over with Enhad?
You go to trial.
Yeah, we had like a full class and they were like presenting some bullshit.
I think those ones that show us the
Yeah.
Your handwriting.
Yeah, stop.
No, that's not that.
Maybe sometimes there's situations that
No, also it's
Freaky subjective opinion.
it's the first
Okay.
time
Wait, what?
should be putting yourself in the position.
They might want to die. It's like, what is the problem? You're putting yourself in the position of
But they all have to.
incompetent.
Yeah, your criteria must be favorable. So if they want to die, like it's.
But don't we all have to do
Wait,
it?
yourself? What's the problem with
Yep.
having
Do those 2 points like must substitute yourself into the individual? Do those only apply to number
Wait,
6?
really?
Yeah, these are both explanations of number 6.
Okay.
Oh, okay.
Both are included.
What's the problem with like having to put yourself in the position of incompetent?
How many groups have any groups that don't have at least 1 point?
We have a point, but it's really not.
Ah, well, we'll start with you then. Okay, I'll get you to stop for a moment. Just a couple minutes. Zane, your group, what's your really, really bad point?
We're doing number 6, right?
Yeah.
Okay, so. Alright, let's see here. So subjective reasonable standards
Yeah.
/ substitute judgment.
Yeah.
Oh, okay, so like,
Did you have a bad point or were you just lying?
not really.
Okay, what's
Okay, so basically it's like, it's kind of, I guess it's kind of difficult to like put yourself into somebody else's shoes entirely, you know? There's always some sort of bias, I guess.
yes?
So, yeah, and so that would be probably affect your proxy decision to some extent.
That is probably true of all of them, but I will say you're on the right track with that one. Yes?
We were thinking like the second part, maybe sometimes it's better to not be in favor of life if their situation's really bad. Maybe like killing them is a better option.
Killing them. Like, it sounds like murder.
The first part is like good, like you should be putting yourself in their shoes and making the decision that they want.
Okay. So if sometimes life is not the best option, that's a great addition to that. Then what is the problem with that? What is the ethical problem with that? So on the right track there, and we're on the right track there. So I did there. I'll use my right hand bias. Next group to my right. What's the next group over from Zane?
It's very open to interpretation. Like the person can like purposefully like they can say that they're like putting themselves in the position, but in reality it's just like what they want. So it's very
Oh, yes,
open to
yeah.
interpretation.
They could fake it. And that's true. They may not actually be, but that's more related to point number 4. It is their responsibility. Unethical people will do unethical things. All of them will suffer from the proxy. The proxy is secretly putting in their own decision and they've broken an ethical rule. That's between them and all the guilt they'll feel. Or hopefully maybe some sort of court. Moving forward, you have a lot of writing.
Yeah.
Best one. What's your best point?
I say one you should share.
Excellent.
Okay, right.
So, like, their own beliefs might be like incompetent, I guess. So like, someone could have grown up in a cult and had like freaky subjective opinions that might have been formed competently, but they could be like informed by like bad ideas.
Sure. I think that's getting a little off the beaten path. In that when I say incompetent, we mean biologically incompetent. They're like a toddler or someone suffering from brain damage. If their beliefs are incompetent, we call that the sweet smell of freedom. So you are allowed to make bad decisions based off of bad beliefs that you believe badly. So if you've been watching conspiracy network news and are firmly of the belief that vaccines cause harm, and that Bill Gates is going to program you with all the microchips inside the vaccines, and you refuse a life-saving vaccine, and then say join a cult, you're allowed to do that. You're allowed to do that. So that it might be an incompetent belief, but it's not an incompetent person. If I can make that distinction.
I think he meant like using subjective, to really make sense, because someone could have like really different like subjective standards than another person, and they could be really objectively bad.
So hard to judge subjective standards because they're not objective. That is true. We do have an area of it's not ethics but philosophy that judges subjective standards. You would be in that area if you're trying to distinguish between the quality of two different films or paintings or other subjective opinions. And someone's standard of life is within their own head, so it is hard to get away from the subjective reasonable standard. But this does make it fairly objective. Always must be in favor of life. So it does anchor it a little bit there. I mean, here.
If a person's like brain dead, I feel like it's kind of hard to put yourself in their shoes because you're not brain dead and it's impossible to imagine what it's like to be brain dead because you're not. So you don't know what they would want.
Yes. Say that again, but pick an example other than brain dead. Brain dead is a fairly extreme example.
If a person has brain damage and their thoughts are like, okay, let's say you have schizophrenia and you like completely believe the voices in your head.
Yeah.
Like it's a real person telling you what to do. I can't like imagine, I can't perfectly replicate and simulate those person's thought processes in my own brain because I do not have schizophrenia.
You are so close. So close. That is like right there.
To what?
To one of the major problems with it. So absolutely true.
It's
It
like,
might be impossible to do. What if it is possible? Yes.
Like, if someone needs a proxy, that's not.
At the back, yeah.
Everything's already been sent out.
Well, I'll open it. Everything has not quite. We're very close with this one. Let's pretend you could fully put yourself in the shoes. You could be someone who is brain dead, or you could be someone who is schizophrenic. You could fully understand and get into that mindset and do that. What would be the problem of requiring proxy decision makers to do that?
Well,
Yes?
Then, like, I'm not thinking straight.
Then they're incompetent.
yeah.
We suffer from the logical problem. If you can truly put yourself into their shoes,
Then you're
you are,
incompetent too.
yeah, then now you're incompetent too, and you're going to make decisions based on an incompetent mindset. If you put yourself into an incompetent mindset, then you'll make decisions from an incompetent point of view, which is the exact problem we're trying to get away from.
Yeah, but you can like fully understand a person's like situation, like they're like, for example, have brain damage or something, without having brain damage.
Yeah, I think it's a difference between like completely understanding it or like completely like becoming it.
Yeah.
Because if you like completely, I don't know if I'm getting it right, but if you become incompetent by fully understanding that the person is incompetent, didn't you auto-cause you like brain damage without doing anything? Yes. Imagine if you have brain damage and you have brain damage.
Well, if you imagine, like, let's say you run a little model in your mind.
Yeah.
I'm going to model schizophrenia. You can model what it's like to hear voices because you were supposed to put yourself into their position and decide what they would want. But now you're making decisions as if you hear voices. Like you were making decisions as to what they would want being incompetent,
Which is the problem you're trying to
which is the problem you're actually trying to avoid.
Oh, so you're putting yourself in like a point of view of
Yeah.
like competent, like actual point. Oh, okay.
Now this has been arrived at, I think, almost exclusively because of the second point. Because they put it there, you don't truly know what they want, you must fully put them down to your shoes, and then they get away with saying, well, you must always be in favor of life. If you are always in favor of life, What does that do to the duty of a right to life? What does that do to a right to life?
Takes it away.
Takes it away. Now what does it become? It's no longer a right, it's a obligation, it's mandatory, it's a duty. So it takes a right and turns it into a duty. Makes a right. And now the incompetent have less rights than the average person. If you were in horrible pain in the province of British Columbia, you would have access to MAID, medical assistance in dying and euthanasia. If you had that particular decision making, then that person would never be able to exercise that right. They couldn't even refuse treatment at any particular point. Yes?
Have there been any cases where a person has pretended to be incompetent just to get out of their obligations and duties as a person?
I'm sure there have been. I'm not aware of any famous cases, but I'm sure there has been. You are trying to convince doctors. There's one particular, it wasn't to get out of responsibilities. You'll find this quoted in people criticizing psychology studies and criticizing psychology all the time. A professor took a bunch of students and said, I want you to pretend to be insane. And then voluntarily commit yourself to a hospital. So they walk into a hospital and they say things like, I've been hearing voices, the voices tell me to do these things. Like, they're giving criteria provided by the professor that fits a criteria for a multiple diagnoses. And the professor's aim was to show, how long does it take you to get out of there? And are they able to distinguish a sane person from an insane person, someone with mental health problems? And one of the outcomes was normal everyday activities were measured and viewed as abnormal. So one particular young woman liked to write in her diary every day, and there are doctor's notes about her graphia obsession because she loves to write, and that might be evidence of her manic phase in her manic depression that she was doing. A lot of very ordinary behaviors became viewed as unordinary.
Like as soon as you're told to focus on it?
Yeah, as soon as they're in there and they'd be observed for other people, they were being judged as people with mental health problems. And a lot of the regular that we would just dismiss and anybody else were like, this is a problem. Now the defense of that is they were all eventually let go and said, you're fine. So they weren't like kept, but a lot of the times they were recommended not to leave. And from doctors on the other side who say, well, these patients showed up and they said they heard voices. The mere fact that those voices went away doesn't mean they're better. And essentially, they lied about their symptoms. If they hadn't been lying, it was actually entirely appropriate to look at all these behaviors and try and connect them to see what was going on. And eventually they figured out, like, well, they're not getting any more, and they did let them go. So it wasn't so much that they were being viewed abnormally, as that they were trying to grasp for anything to try and diagnose them, given their symptoms. And if they didn't have the symptoms, health is not set up to deal adequately with people who lie all the time, because there has to be that establishment of trust.
So is there like any proof that these people actually have these conditions, or is it just
No, they just,
what they say?
if you show up and you say I'm in pain all the time, there is no objective standard. There's a certain condition where you are in pain all the time. There's a type of muscle ailment. There is no objective scientific test that can show that that's actually occurring. So all we have is your reported symptoms, and the treatment is medication and drugs to reduce the pain. And we only know they're better by them telling us. And that's really no different than a psychiatry patient who shows up and says, you know, I'm having these problems in my life, and they go through that too. We only know people get better in many cases with mental health is because they say they do. It's not like a broken leg. Anyway, you can return to your seat. Some of you are just standing. I don't want to make you do that for too much longer. So our two main problems turns the right to life into a duty to life. And logically, if we put ourselves in their position, we ourselves would be incompetent. And this is not a trivial haha, you've just turned yourself incompetent. It is a logical impossibility. You are trying to do the one thing that you are supposed to not do. You are supposed to make a decision from a competent stance on their behalf. And if you fully put yourself in their shoes and you model what they would want, then you're just making the decision they would make anyway. Yes?
Isn't that like how it's like don't become a monster when you're like fighting monsters? Isn't that like
I like that analogy, yeah. A modern issue with this, for the first time ever, we have used CRISPR to heal deafness in a person. They had a genetic disorder in which they lacked certain types of receptors. They were given CRISPR as a genetic therapy, and they are no longer deaf. Now, the deaf community is against this procedure, as they are against cochlear implants that can help you hear. Because from their perspective, parents are acting selfishly. You have a child who is deaf. They can learn sign language. They can exist in the world deaf, and it doesn't actually change too much. They have their own language, grammar, culture. If you cure them before they're old enough to make consent to it, then you are depriving them of the ability to live in that particular culture, which would be like depriving anybody from being able to live in their particular culture. And if they're born that way, maybe they should stay that way. This is an actual ethical concern that gets brought up whenever we talk about deafness. It doesn't seem to be brought up quite as often in the blind community, probably because there isn't a whole separate language and culture that has grown up and around it, because if you're blind, you're still using the same language everybody else is. But if you're signing, it has its own syntax, it has its own rhyming mechanisms that has to do with motion. It has a lot of differences from our language. Because if you sign, you're not just translating English into signing. That doesn't work. It has to be its own language for it to work properly.
We do live sign language.
Yeah, it has to do with similarity of motion.
You rap about sign language?
I don't know of one, but to be honest, it would not surprise me if you can. Also, you may have heard of chimpanzees and other animals that have learned to sign and communicate with humans. As of 2024, I believe it has been concluded that there hasn't been a single verifiable instance of that ever happening. All instances are considered to be trainer imposed and interpreted. Pardon?
Coco is a fraud.
Coco is a fraud. Yeah. We have 1.5 minutes, and I'm going to just start with Stephen Dawson. Poor Stephen Dawson. Yeah, no, you got 1.5 minutes. You can do 1.5 minutes. He's a poor 7-year-old boy. And he got meningitis. Does anybody know what meningitis is? Yes?
Very deadly disease.
Very deadly disease. It infects the meninges of your brain, which is the tissue covering of your brain between your brain and the skull, Timmy. And you may have also heard of it as the kissing disease, because it can be spread through saliva. So someone gets meningitis here at school, that would be a concern because other people can get it. And if you're this old, usually you'll be fine. We'll give you some antibiotics. But if you're swelling the brain itself, particularly when you're developing, it can have complications. So he was 7 years old. He contracted meningitis and ended up with severe brain damage, very delayed mental development. He had no control over his limbs. He would slap himself in the face by accident, dig his claws, fingers into his own arms. Very, very incapable. And because of the brain's injury, it would overproduce fluid. You have fluid surrounding your brain. So they needed to install a shunt, which is a valve that periodically opens up and relieves the pressure, like a steam valve in an engine. It actually relieves it into the throat, so you just swallow it without knowing. Yeah. I know an adult who has one. Just gives him a little kick on the back of his throat every once in a while as he swallows his own brain fluid. No. Okay, that's it. I'm so glad that you were here for that at the very end.
Oh, I'm really
Yeah.
quite awesome.
It's Chef's